the fellows have been down, and I understand there are 20 tapes in the library at the college.
The osteopathy would prevent the autism and various serious
Yeah, I'm
problems.
back on track. You know that the newborn head comes in parts. The bones are not as they are in the adult. The occiput is in 4 parts. The sphenoid in 3, the temporal in 3, the ethmoid in 3. And as Bill Rankin used to say, it's like a soft-shelled egg. So whatever the mechanics of delivery may be, the infant head adapts to the passageway. That's what I was taught. Is that what you were taught? Yes. Consequently, when it emerges, it takes its first breath because of the atmospheric pressure. We're 14.2 pounds per square inch, and that inflates the alveoli. And so you have respiration beginning, and the Apgar score is to check whether all of the vital machinery has started. What the Apgar score does not check is how this soft-shelled egg realigns its parts, including the sacrum between the ilia. Therefore, what Dr. Sutherland taught was that the cerebrospinal fluid, which has gone down into the spinal canal during the delivery, comes back up and produces a hydraulic lift from inside to make the infant cranium spherical. And that is why most obstetricians that I've ever heard of will tell a mother who's worried about the shape of her new infant's head, oh, well, in a few days that will straighten out. Don't worry about it. It usually does. But sometimes it doesn't do it completely. So what Dr. Sutherland emphasized to start with was the forward parts of the occiput and compression of the condylar parts, which will affect the shape of the foramen magnum, through which the medulla oblongata has passed to become the spinal cord. And if there is a distortion in the shape or the size or both of the foramen magnum, the pyramidal tracts, which are the motor tracts from the cerebral peduncles, from the motor tracts in the cerebrum, are underneath, all along the brain stem. And if the medulla is jammed into the foramen magnum, and that edge is pressing on the pyramidal tracts, the influence from the motor cortex is reduced or eliminated. And if it isn't there, it's an inhibitory, regulatory, neurological influence. The segments dominate, and what you get is cerebral palsy. So, you get the spastic type. And of course, however it gets shaped up, it starts to grow as the child lives. And so if there is compression on any part of the central nervous system caused by the bony container and the shape it gets in, the problem gets bigger because they grow. Therefore, if you straighten them out right after they've arrived or before they start holding their heads up, you're going to realign the cranial base with the atlas. You're going to check the sacrum between the ilia so there won't be a pull from the spinal duramater, and you're going to produce a vault lift which allows the cerebrospinal fluid to get everything floating around the cartilaginous space. And if you've got an infant with a proud forehead, that the frontals can turn and that can go in. All sorts of things which are not producing any particular trouble at the moment. Well,
homeopathic treatment can have any effect on any of this at all? You know what I mean? Well,
oh, I know very well what you mean, because they thought I was nuts, to make it simple. And a couple of, we worked with the Parents' Council for Retarded Children when it was just getting started in the 1950s. This was because Dr. Sutherland said to everybody, if you have parents who have been told to place their child in an institution, you can offer them encouragement, perhaps more than encouragement. He got everybody to working in this field. I had no experience in it before then. I'd been treating children. I practiced obstetrics for a while, and I treated children with all the childhood illnesses by making house calls at home, because this was the era before antibiotics. But I didn't know that there was a whole group of children who had problems in this area. And they were usually manifesting their problems when they got to be 2, 3, 4, and 5. And there was a social situation that I didn't know about, got my back up. I don't know whether it's universal or not, but it does seem that there has been a theme in human society that if parents have a child with something wrong with it, there's something wrong with them. And consequently, parents have been keeping the children with handicaps at home and hiding them. And this Parents' Council organization got them out. And that was a healthy thing, because I've never seen people in such a state as these people were when they came to a dinner where they met other people with the same problems.
Had the physicians, the MDs, written off these kids?
So there were
What I mean?
teachers and nurses and 2 MDs who were being helpful at the same time. The big issue at that time was the early 1950s. Who are the children so afflicted, and where are they? And do the pediatricians attend them? Well, there had been some very good pediatricians in Providence that really helped mothers through their initial education and taking care of the baby. But that generation was passing, and there were these two pediatricians, one of whom was working toward becoming a pediatric neurologist, and they got the state to investigate the possibility of enlarging the school, the lad's school down in the country, where you could send your child who was handicapped. But it was named for Dr. Ladd, who was a pediatrician in East Greenwich. He was doing the best he could with what he had to do with. But suddenly, there was this clamor for evaluating all the children, especially the children who hadn't been accepted into a school, kindergarten or first grade. So they got the Parents' Council to bring all the children who'd been hidden out into the open, into an evaluating program at the Providence City Hospital, the Chapin Hospital. And these two pediatricians were really having a competitive attitude toward each other because they wanted the job. Well, they were also just as new to this public as we were. And they were surprised to learn that we had this Saturday morning clinic. And one of them got up, well, he was on the platform giving a lecture, and he looked right at us and made derogatory gestures and said out loud that we had no right to have a clinic. Well, I looked up the word clinic in the dictionary, and it's two or more professional people who work together to make a public service. Anyhow, we continued to have our clinic. Our colleagues did not support us, and because we were treating the head. Now, it says in all the anatomy books of the past, I don't know of anyone that's different, but there may be, that in the adult, the bones of the human cranium ossify or fuse. And mine hasn't gotten around to it yet. And I'll be 92 next January. So my Dr. Sutherland, you see, finally had people who, in the profession, who were interested in his experience with viewing the living human cranium from the viewpoint of the science of osteopathy. And so we heard him in New York, and we just thought this was for us. So now, ever since, you see, I look at the whole body, including the vault, as well as the feet. I've been treating feet since I was a junior in college. So this development worked so that all the children in the state of Rhode Island got evaluated and diagnosed. It had been the custom of obstetricians and pediatricians who recognized a line in the hand that a newborn infant had Down syndrome or some other things. And it was the custom. I know it's horrible, but it was a fact they told the mother of the newborn, she was supposed to tell her husband, I suppose, that her infant could never learn. Therefore, they should put it in an institution before they began to love it. Now, that was traumatic to the parents, of course. I don't know how it was carried out. There was a place in the western part of the state where some nurses were running a little infant hospital where you could send the people you were supposed to send. And I think of newborn infants as people, incidentally. But with all of this development, some of this climate was changing, you see. So, there was a school called the Meeting Street School, which undertook to provide teaching and education for these handicapped children with cerebral palsy or this whole list of problems. Then there's a very nice large building called Rhode Island School for the Deaf that was not far from where we were living. The way it was, if you had a child with congenital deafness, you could get the child into school there, or maybe even board it there. They really had some wonderful programs and teachers. But if your deaf child also had cerebral palsy, it could not be admitted, or any other handicap. For Meeting Street School and any other programs there were for the cerebral palsy and handicap, your child couldn't get admitted if it was deaf.
Can you tell me something about some of the children that you treated at your clinic who had these problems? I mean,
Sure.
you know, did you ever have successes with them that MDs said were impossible?
Yes. What I'm starting with right now is that we got the children nobody else would accept. And they lived at home. And they came to our office on Saturday mornings. We had a speech therapist who worked with us. And we decided that everybody would be more relaxed if they paid a little something. But we didn't know what we could do. And so the fee on Saturday mornings was 50 cents. And mothers who had other children had to bring everybody along because there wasn't anyone at home. So we had child-sized furniture, and I've still got the blocks we had to entertain the brothers and sisters of the patients we treated. We treated them with what Dr. Sutherland had taught us, especially with multiple hand techniques. And then Margaret would take them into what was ordinarily my office for a speech lesson. And I have 180 case records in the other room that Lisa Mulder and I were working on. But she's going to have her fourth child in a couple of weeks. And I've been on some other tracks, so that project is down. But what I want to do, what I've wanted to do for the last 30 years, is to tell the stories that are in those records. And some of the children we accepted died. And some improved, so they went to public school and were in the mainstream of education. Some of them went to public school, but they were in special education. And then, as events developed, the Parents' Council for Retarded Children wanted to have a nursery school for these children who weren't accepted anywhere, but they could learn. And so Margaret started the nursery school for them. And this went on. And I learned. There were some children who could not speak. The reason why they could not speak was because the occiput had jammed up, so they compressed the canal for the nerve to the tongue. And you can't speak if your tongue won't work. They could make signals with their mothers. You can make vowel sounds in your throat, and they could say ah, e, or they had a kind of a language and gestures that was helpful at home. But there's something funny in our human attitudes. I'm included. I'm not talking about other people exclusively. But if somebody doesn't speak, you think they can't hear. If they can't hear, with congenital deafness early, they don't know the language. And that's what they're down the School of the Deaf is for. They can learn this. Is, well, Helen Keller is the example of what the nervous system will develop naturally if it can get information. But if the doctors said a child couldn't learn, the adults in their environment didn't teach them. And if you're not taught, you don't know some things. So these handicapped children were handicapped by an effect that didn't have to be.
So you had cases where the hypoglossal nerve was pressed, that once you treated that area, the kids began to be able to talk.
Provided it hadn't atrophied. This is where, when you can do it in the first 3 months and realign anything that you can find in the structural mechanism of the infant body as an osteopath, you're getting everything to work naturally. You're removing any handicaps. It takes growth and compression, growth and compression. And how many infants do you know who learn to walk without having sit-down falls? And so it takes time before the problem is recognized. And what happened to the MDs was in some literature I received in the mail, advertising something or other, but it told me something I wouldn't otherwise have known, that at that time, the MD pediatricians in this country, for the most part, didn't know any more about children with these problems than I did. But they'd located a professor of pediatrics at Yale Medical School who had just retired, who was especially well informed, and he was involved in a program to update all the pediatricians in the medical profession. But that was simply to recognize the problem, and of course you have to start with that. The idea that there is an osteopathic problem hasn't dawned yet, I think. Viola's doing a good job of trying to get the word around the world, but if you don't recognize the problem, you are not concerned with solving it or with taking it into consideration. Now, I saw something on the TV just the other evening. I don't look at the TV very much except at 5 o'clock to get the weather. Oh, yes. Is that fan making too much noise? It seems, on Channel 5, this girl gives some report on what she calls the health beat. What she was saying, I don't know where she got it at, was that too many doctors are recommending Ritalin. Now, they are seeing that the normal behavior of normal children as they expand with the world they live in gets interpreted as attention deficit syndrome. So now the word is out that there are too many children who do not have attention deficit syndrome who are receiving Ritalin. And that tells me that the professional world in the healing arts isn't aware of these problems as I see them today any more than they were in the 1950s. There seems to be a difficulty in recognizing that all vertebrates, starting with the jawless fishes, have an articulated endoskeletal system. And that means a midline vertebral structure with paired lateral structures on the side. And everything is hitched to it. The endoskeletal system means it's on the inside. The exoskeletons are the crabs and the lobsters and so on. And they carry their support system on the outside. If there is a mechanical strain in the endoskeletal system, it obviously affects everything that's attached to it. And that's what I was trying to say in that. So, the shape of spaces, the size of spaces, the functions, all may be affected. And that's what the science of osteopathy is about. But the orthodox medical profession is still hitched up with body chemistry. And if there's a disease, they attack it with a medication. And the research is involved with what is good for this disease or that disease. And then there isn't any doubt about the fact that sanitary engineering, personal hygiene, and recognition of infectious and contagious diseases has changed a great deal in the last 150 years. And since the antibiotics have become available since the Second World War, they do enhance the power of the human immune system to resolve this infectious process immediately. The only thing is, I've been retired for so long, I don't know what's going on out there, but I must say there is evidence that many doctors just prescribe some antibiotic over the phone for anything they hear about. And it's getting so the bacteria are becoming immune to the antibiotics. And I don't know what that's going to do. But we have a plague with this virus that developed at the borderline of the natural world and the human world in Africa. And we have a new plague of tuberculosis around here. And I understood that the title doctor was taken from the academic world, and it really means teacher. And so I think physicians are public servants who also have a duty to teach the public about what they know so that they can think straight in any event. I don't think you're teaching people anything if they call you up and you make a diagnosis over the telephone and you tell the pharmacist to get them an antibiotic. You really haven't examined your patient. And this takes time. So my young friends are telling me something about how managed care is a part of the world they're going to start practicing in. And some of them, economically, it costs them more to get an education today than it cost my parents to give me mine. And they will take a job in an HMO or some other arrangement to get some money.
Right.
And solo practice is not so attractive now.
Now, when you had your children's center and you were treating, so you had some very good successes treating, quote, incurable cerebral palsy.
Yes.
And helping the children who had cerebral palsy improve dramatically.
Yes.
And so, and with autism, you also had some significant successes.
We had...
Do you remember any particular people that come to mind? I'm going to see what that does. Is that okay for you?
It will go even higher on to...
That's good.
Is that okay?
Yeah.
Not your eyes or anything?
That's fine.
Okay. Do you remember any particular patients that, that sort of goes along with your telling the story of the patients who, autistic children or cerebral palsy children who had some amazing, that the techniques were effective for?
I remember particularly one boy who was 6 when I inherited him. My husband and I had been treating him with forehand techniques. My husband died, and so he came and sat on that table as usual. He did not speak, and he had a habit he was doing this all the time. And came because he was used to coming there. And I thought, how am I going to treat him without Chester, without the four hands? But he was doing this on the table. I had a brainwave. I pulled his stool up and I put my hands on his pelvis and just balanced it and held him down to the table. And he kept this up, and it worked better than anything else had. He got his sacrum loose and his neck with it. And the next fall, he entered the mainstream in his school. He got out of special education. And
do you have a thought about how that happened?
I just thought that was a bonus.
Do you think the sacrum freed up the mechanism enough that...
I think in his case, the pull from the sacrum through the spinal durameter on the occiput was holding the reciprocal tension membrane in the cranial mechanism, so that growth was under stress, and that by releasing the sacrum, he was really vigorous, and I have no difficulty remembering him because this was a surprise, and I was simply improvising, but it taught me something. You see, that I was working with the problem we'd always been working with, but the patient put the power into it, and then his mechanism began to work better. And there was one girl.
Was he able to speak then? Or
What there?
This young boy, what else changed that you noticed? Was he able to speak? Is that why he was able to get into the main program?
Yes, apparently he had been speaking some, and but I didn't know it. But once he'd been in special education, and he began to, of course I didn't see him anymore, so I just heard from his mother that he was going into the second grade without special education, and
he was a child.
I don't see how he could have done that if he hadn't been speaking.
So he was one of these children that had no real future in front of him before you started treating him.
That was it. But obviously, he did not have the pathology that can happen, and doesn't have a name.
If it's
mentally retarded. They did stop using in the 40s and 50s. They changed. They, being the medical world in general, they changed their language some, so they stopped using imbecile and idiot and other mongoloids, and all these had connotations that they decided. They haven't got the language straightened out yet, but it was an improvement to speak of the retarded instead of idiots. And it was an improvement to speak of trisomy or Down's syndrome instead of mongoloids. The children with this genetic problem do have faces that resemble Mongolian faces, Oriental faces. But it's a matter of their developmental anatomy in the last part of pregnancy. The pre-sphenoid, that is the front of the body of the sphenoid, and the roots of the lesser wings and the lesser wings themselves are supposed to ossify with the post-sphenoid so that the floor of the sella turcica is ossified and established by delivery. But if it isn't, the pre-sphenoid may go up or down. There may be a shearing effect between the pre-sphenoid and the post-sphenoid. And if there is, the nasopharynx, the space in the nasopharynx, the airway is crowded, it's reduced. And children with Down syndrome have difficulty breathing. And one of the characteristics with some of them is that they stick their tongues out. They stick their tongues out so they can breathe. By getting their tongue out, the airway is opened up. And these facial appearances and behavior that goes with it has all been labeled through the centuries. But Rebecca Lippincott did a lot of work with, she got this into my head, that if you can get the pre and post sphenoid lined up and do facial work to get more room and release the compression around the condylar canal so the 12th nerve will function. If the child is young enough, you can do this, and even if they do have trisomy, they can function and learn and grow. And it is not necessary to put children with Down syndrome in an institution. They do better at home, provided they can be treated like all their brothers and sisters. What do you get when you treat any child as an isolated handicap? If you don't teach them, you don't include them in, you don't cuddle them, you don't play with them, you don't talk to them, you don't listen to them, you keep them from growing up, don't you? And
does the osteopathic techniques actually affect the course of Down syndrome, you think?
I can't make a long list of this, but I have treated, I don't know how many children with Down syndrome. I Lisa helped me to classify. I think I've got 30 records of them. And the ones I remember were ones who were included in their families. And I treated some children with Down syndrome before I studied with Dr. Sutherland. And they weren't walking. I mean, 3 or 4. I got a picture. They could sit in a high chair and be fed, but they were limp. And I treated them. I don't know how long, but they got to walking. And when they get to walking, they get to doing other things. Their whole being is developing. They're beginning to live instead of just being treated like a doll. And the difference is sort of a spectrum. There are those more severely handicapped and those less severely handicapped. But they can learn to talk, provided the world they live in will listen to them the way they can talk. Mm-hmm. And get the message. So the communication begins, and then it gets to be an experience. And that just like any other living creature, they learn to live by living. And I don't see any probability of a big sweeping prescription for dealing with them. What it needs is thoughtful people in the family, in their daily care, in the professionals who consult with their family and encourage them. And then they should have social experience. And I don't see any reason, never having had children myself, I don't suppose I'm authority, but I think that human children are generally sociable. And they will include in their activities a child who isn't just like them. And they will tend to be protective, and they will repeat instructions. She didn't say that, she said this. Didn't you get it? Mm-hmm. And it's the world of childhood, and I just think that most children who can function at all are going to learn and grow if they're included in.
You were going to start talking about a girl also? You were going to start talking about a girl also in the clinic that you remembered?
Oh, yes. She was 4 when her mother brought her. They lived in Braintree, so her mother had to take a trip every time she came to Providence. This was her first child. And she was folded up in the fetal position, absolutely rigid. Her mother was bringing her in like a package. And we treated her regularly in our Saturday morning clinic for years. And during that time, she unfolded. She was a spastic cerebral palsy, but she had some control, and she could stretch out, and she could make some intelligible sounds. I've got a cassette somewhere in the house here with Hatsy making, learning to speak. Our speech therapist was working with her and working at the level where she could function. And you wouldn't call it very much, but it was progress. And then she had a sister, and later she had another sister. So that you might say that family were friends of ours. And then they moved to St. Louis. Oh, I know, the father worked for Monsanto, and he got transferred to St. Louis. So we stopped in 1956 to have dinner with them. And that's how come I got a little tour of the botanical garden in St. Louis before we got on the train to go up to the Wabash, to go up to Kirksville. But all three girls were doing well. Of course, the mother, who was an RN, had to take special care of Hatsy because she was always limited. But she changed in the direction of more and better function. I think she lived to be 18 or 19. I get a letter from her mother at Christmas time sometimes. The other two girls are married and have children, and they're down on Cape Cod now. But that situation was the most severe spastic type of cerebral palsy that I recall.